Mhm. Now we are live. Good morning, good afternoon, and good evening to you from wherever you're tuning in to watch another important discussion being held by the South Sudanese Women Intellectuals Forum. We welcome you all. The title for our topic for this discussion is The Role of Nurses in Health Service Provision and Critical Care. Nursing is one of the oldest, most respected professions. The role of nursing in health service provision has been of utmost importance in ensuring that patients receive well-rounded care. Nurses serve a primary point of contact in the healthcare system and therefore are able to pick up many issues that may not be picked up further along. Sick individuals are also able to build a better rapport with nursing professionals, and nursing care is one of the most important aspects in recovery from illness. It is therefore imperative to understand the role of nurses in healthcare and how they can also be able to assume roles that give them further responsibility and opportunity to contribute further to the care of patients, community, and assert their impact on public health. Today, we will be discussing the role of nurses in healthcare service provision and critical care. We are honored to have panelists who come with a wealth of experience, skills, and knowledge in their profession, and they will focus on different specialties, the challenges experienced, and possible solutions and recommendations. We would like to thank them for joining us and taking their time to be part of the discussion. We would also like to thank the audience for joining us. We're currently streaming live on Facebook and YouTube. Please feel free to share the discussion on all your social media platforms and ask any questions on the discussion on the Facebook page. We would also like to thank the UN Women for provision of internet and safe space for our panelists, and Aisha and Robert for technical support. We look forward to a fruitful, eye-opening discussion. We will go straight into the introduction. Our panelists are Ms. Joyce Youngu, Ms. Mary Kujang, Ms. Nyandra Tang, Ms. Anna Modong, and Ms. Agnes Moody Lomoro. I'll go ahead and read a brief biography about each of our panelists. Ms. Joyce Youngu holds a diploma and a bachelor's degree in nursing. For over 10 years, she has worked in the healthcare system and community service. Her nursing experience has involved caring for youth and medium-aged population with mental health issues and also providing residential care services. Furthermore, Ms. Joyce is the Secretary for the Equatorial Community Association Western Australia Women Office. She was among the key women involved in the development of a recipe book project in 2020-2021. The project has brought the community together by raising understanding of our culture and traditional foods. Also, the project facilitated awareness of our South Sudanese culture and traditions from the Equatorial region of South Sudan. Our next panelist is Ms. Mary Kujang. Ms. Mary Kujang is a graduate of Upper Nile University, Khartoum, where she received a degree in nursing. Upon graduating, she worked at Juba Teaching Hospital and in Al Sabah Children's Hospital in Juba. She has also worked in Lanya PHCC in Central Equatoria and has experience working with NGOs as well as MSF and IMC in Maban. Currently, Ms. Mary works in Juba in IDU where she focuses on the critical care of patients affected by COVID-19. She also provides services with UNH in Juba and for home-based care for individuals with COVID-19. Then our next panelist is Ms. Nyandra Tang. Ms. Nyandra is a mother of 3 phenomenal children, Marna, who's 19 years old, Moj, who's 5 years old, and Mobasi, who's 3 years old. She's a retired Army nurse, community leader, mentor, successful entrepreneur, and an advocate for women's rights. After medically retiring from the Army through the Wounded Warrior Battalion due to post-traumatic stress disorder, Nyandra focused her energy into serving South Sudanese women by launching Republic of South Sudan Girls Breaking the Silence organization. This nonprofit organization provides mentorship to women worldwide, connects them with mental health counselors, delivers education through social media, and encourages others to speak up about the past trauma to promote healing. She has overcome many obstacles as a refugee. Her dream is to impact lives, bring hope, healing, and transformation by empowering, inspiring, and motivating others to live their own life and dream being despite their environment. As a single mother, Nyandra worked tirelessly to build financial wealth and gain national and international attention. She has been featured on Good Morning America, local ABC televisions, CNBC, The Approach Times, The Authority Magazine, Thrive Global, and The Dave Ramsey Solution. Her vision is to empower others to succeed despite adversity and inspire people to speak up against cultural norms that were put in place to silence women. She coaches others on becoming debt-free and teaches entrepreneurship using strategies and methods she implemented to grow her own business and develop herself as a leader. Nyandra is currently based in San Antonio, Texas. Our next panelist is Ms. Anne Madong. Ms. Anne Madong is a nursing office and nursing midwife tutor. She has over 4 years of experience in tutoring and clinical practice both in South Sudan and Uganda. Currently, Ms. Anne is an intern nurse at Mulago National Referral Hospital in Kampala. Ms. Anne studied Bachelor's of Nursing from Uganda Christian University in Uganda and attained a certificate in adolescents, sexual and reproductive health from Geneva Foundation for Medical Education and Research. Ms. Anne is driven by her passion to see a better South Sudan healthcare system where no one is left behind and ensure a better understanding of nursing profession in South Sudan. Ms. Anne is currently an active member of the South Sudan Nursing and Midwifery Council, South Sudan Nurses and Midwives Association, Uganda Nurses and Midwives Council, Geneva Foundation for Medical Education and Research, Nurses Now, and Global Implementation Society member. She's the 2021 ambassador. She plans to continue uplifting the nursing profession in South Sudan specifically and to ensure that nurses are involved in policymaking that affects nurses and midwives directly. Our final panelist is Ms. Anne Moody Lomoro. Ms. Anne Moody Lomoro is a registered nurse. She graduated from Daystar University in 2018 and holds a bachelor's degree of nursing. She then completed her internship at the Kenyatta National Hospital. Thereafter, she worked at the Karen Hospital as an AE nurse from November 2019 to February 2020. She also worked as a primary nurse at the Nairobi West Hospital in Kenya during the same period. From November 2020, she was at the front line of the rapid response for COVID-19 at the Mpasha Hospital in Nairobi, Kenya. She is currently based at RFH Rai Family Hospital in Nairobi at the COVID ICU. And I am Eunice Malath. I am a registered nurse by profession and media specialist and your moderator for this discussion. During the discussion, we encourage you to interact with the panelists, provide your feedback, and ask questions. I'll go ahead and start off by asking Ms. Joyce Youngu the first question, which is, describe the different cadres in nursing, their roles and why it is important to have different cadres. Also, what are the possible career trajectory paths when one chooses to go into nursing? And what can be done to encourage individuals who are interested in getting into the nursing profession?
Thank you, Eunice. I'm very honored to be in the panel. Thank you, everybody who are involved in this discussion today. You already heard my name. Thank you for the question again. So I did the nursing in Australia, so I'm going to talk about the nurses in Australia and their roles. So in Australia, there are so many different nurses. So basically the role The nurses start from INs, that was like carers, we call it here carers or INs. Then you go and do your diploma, that is in college. I don't know, in South Sudan, we call it college, it's a diploma. And then from there, if you're willing, then you can go ahead and go to university and do your RN. So doing that, there are different roles that you'll be involved as a nurse. For example, the healthcare assistant, that is just a, she work with the nurses on the floor, helping with showers, helping with basic duties in the ward. Then you come to the diploma nurse, registered nurse. Her role is also different here in Australia. For someone who has a diploma in nursing, she can do wound care, she can administer medications, she can assess basic assessments, she can do observation and record them, but she cannot hold the key, the DD key. We call it the Schedule 8 drugs key, drug of addiction. So that's the only thing that the diploma registered nurse cannot hold that key, because it's a big responsibility here in Australia to have that key. Then you become an RN. Diploma take 2 years. You become an RN. You go to university. You take 3 years, 3 years and a half, depend on different kind of university. So you graduate and you become a fully registered nurse. When you become a fully registered nurse, that you become with so much responsibility. You become accountable for your actions. You become in the ward, you become in charge sometime. So you have a role of holding that Schedule 8 key, which is a drug of addiction. I don't know how you call that in South Sudan or in Uganda, or for those who are in Kenya. So we got drugs like morphine, drugs like fentanyl. So those drugs are locked in a double cupboard here in Australia. So it has to be 2 nurses to access that cupboard. The future for nurses here in Australia, because nursing is a very large field, it's a vast area, and it's very intensive also while you're studying. And here in Australia, I forgot one more thing. To qualify as a nurse, you have to go through intensive exam and assessments, plus you have to do the English test. You have to pass the literacy and the numeracy test to qualify a fully RN, and that takes a bit of energy and is stressful. That's why I say nursing is a very intense course here in Australia. So future-wise, once you become an RN, you got so much opportunity. You can become a diabetic nurse, you can become a mental health nurse, you can become a neurovascular nurse, you can become a psychiatric nurse, you can name it. We are all nurses, we all know those areas. So it's not, you are not limited. You are not limited in one area. You can devolve and even reach a high level. Some will go and do midwifery, which is another 2 years. Then you become a midwife nurse, and that also take a very intensive training to do that, which involve the laws and also you are, as a nurse, to be able to be critical on your thinking and your assessments. In that, for me to encourage someone to do nursing, when I came to Australia, I wasn't a nurse. I don't know, I was just me. So I came here, I look around, I said, I want to be a nurse. I found myself doing nursing. When I was in high school, I loved arts. I wanted to be a lawyer. But moving, changing countries and environment, I started doing my diploma, and then I said, I can be a good RN. So I went and did my RN. So if you are there in Australia or in South Sudan, because when I try to look for the information of registered nurses in South Sudan, the information was limited. So if you in South Sudan, I encourage you to find a place, to find a school or to find a training college to do nursing. School is not limited to age. You can do anything in any age. So I encourage all South Sudanese women, young girls, that school is a key for us to liberate ourselves from the society. And thank you.
Yes, thank you, Ms. Joyce. Indeed, there's no limit when it comes to education. Ms. Mary, I'm going to go ahead and proceed and ask you the next question. What is the role of nurses in the provision of pediatric healthcare? In addition, what are the challenges experienced, and what are the possible solutions for these challenges? Oh, I cannot hear you.
I'm Mary Kujang. I don't know if you're hearing me.
Yes.
Yeah, Mary Kujang. I'm a registered nurse from Upper Nile University. I'm very grateful to be part of this discussion. Yeah, going straight to the question, the role of nurses in provision of pediatric health care. As you have said before, that nurses have a largest part in the hospital. We are like the heart, we are like the backbone, we are like the whole package. When you have a nurse, you have the whole package in the hospital, because they are providing a lot. They are the people interacting with the patient, with the family, and in our provision of the healthcare, especially with the pediatric, pediatric are very delicate and so complicated.
Hello? Miss Mary? Looks like her network is not working effectively right now. So we're going to go ahead and proceed to Ms. Nyandra, and then we'll come back to Ms. Kujang so that you can respond to the question. So Ms. Nyandra, the question addressed to you is, what are the most common surgical cases encountered in surgical nursing care? Where nursing services are provided, and what are the challenges experienced, and how are they overcome? Furthermore, when it comes to provision of nursing services in surgery within the military, what are the unique challenges? And is there a difference in training for these, and why?
I hope I can remember all of those questions, Eunice. Again, thank you for having me. It's an honor to be in this program. I've watched it for over a year. It's really doing an amazing job. And as a nurse, to come in to represent nursing, it's wonderful. And I feel honored. I love this profession. I've been a nurse for 11 years now. And believe it or not, all my nursing experience has been in the military. So when I speak of nursing, I'm probably referring to the military because that's all I know. But I know nursing is all the same. The roles, whether you're in the military or you in the civilians, it's all the same. We practice the same care of our patients. In the military or as a nurse, some of the surgical cases that I have seen, I work as a surgical nurse for my first 4 years in the nursing. And some of those cases, whether you're working on orthopedics, you could be working on orthopedics, and most of your cases would be orthopedics, which mean bone related. It's a fall or something happened where it related to your joints. So I've seen a lot of orthopedics cases. There was a lot of just regular surgicals, whether it's abdominal surgery, breast augmentations, some normal surgeries that just happens is an infection that need to be debrided. So there's a lot of those cases that happens. There's also a lot of, you can talk about anything, eyes, surgeries. The unit I work when, we work with a lot of women surgicals related. And most of those would be having a bypass. So there's a lot of bypass surgeries that happen here where I worked. There's also a lot of war-related traumas. chest wounds, abdominal wound, from gunshot wounds. So there's a lot of those cases. So surgeries can be vast. It's we're talking about holistic person, human body. So whether it's a neuro, I took care of a lot of neuro patients as well. So there's a lot of neuro cases happening. In the military, some of the roles that we play that might be a little different than the civilians. In the military, of course, we do assessment, we take care of, we collect patient data, analyze them, do assessment and all that. But one of the roles that we play that is very different is that when we're in the civilians, our role is the same. When we're home in theater here, like in the United States, we work in the hospital. It's all role the same, but we get to deploy. And when we deploy, we play 3 different roles that don't normally happen in the theater. And we prepare for this. This is, as you go in the military, they prepare you that you will have a chance to deploy. And because I joined in a time where there was a war, we had 15 years of war, long war here in the United States. So everybody that joined around that time that I joined were aware that there is a highest chance that you will be in deployment setting, which I had a chance for 12 years to be in Afghanistan. And when we deploy to those roles, they prepare us based on our professions. If you are OR nurse or you are an ICU nurse or ER nurse, you could play a role called FAST. Okay, so there's FAST, which is a field. You go directly to where the fire is, where the action is happening. So we have medics. Medics in the civilian would be like not CNA. It's almost like your CNA, but they play in an emergency setting, like EMT, more like EMTs, right? So we have EMTs, and those EMT soldiers are the ones that are in with the infantrymen. So if an infantryman go down, they go in, and their job is to stabilize the patient. So if the patient is bleeding, they can stabilize the patient right away. And they take the patient out of the field and bring it to the FAST unit. These FAST nurses are ICU nurses, orthopedic doctors, surgeons, and they are right there, maybe at 30 minutes away or 20 minutes away from where the soldier went down. So their job is to stabilize the patient even more and transfer the patient to CASH. And CASH is a combat field hospital. So it's set up. It's a field set up in tents, and that's where I worked. Right, that's where I was. I was a med-surg nurse, and I have been a med-surg nurse for a while. So I was in CASH. So we receive these patients, and these patients might be, an hour away from where they went down, right? So it's still closer, but a little further. So our job was to stabilize them even more for transportation to Germany. That was our closest hospital. So that's what I did. And that's where a lot of actions, I've seen a lot of surgical traumas, and all of these are emergencies trauma. They might have a pneumothorax, or they might need a craniotomy right away to stabilize them, or maybe 3 units of blood. So we have done that to make sure that they're stable for an 8-hour flight or 7-hour flight to Germany. So that's a lot of different than the civilian setting that I would say that I practice as well. So those are the lot of surgeries I've seen. What was the last question, Eunice? Can you guys hear Eunice? Yeah.
So the question is, what are the unique challenges within working in a combat zone?
So the challenge is sometimes it's running out of supplies, and I've seen that when I went to Juba. So supplies issues is a lot, mainly emergency supplies, equipment, whether it's a blood supply. We don't have enough supplies for blood or IVs or anything that you need to stabilize your patient. So supplies is a huge demand in a field setting. Another one is just short of staff. So we might not have enough people. Maybe we had, there's a mouse cow. Yeah, and I don't know if mouse cow is the same word in the civilian setting. Like I said, my job has been in the military, but is where it's an emergency. Something happened where more than one soldier went down at the same time, and now we're critically in need for people, professional nurses or doctors to stabilize these patients. So short of supply, short of staff, and sometimes it's an infection control issues. We're in the field, we're in a setting where things are not sterile. So infection control is a big problem that we also encounter there. And then just exhaustion, because we work 24/7. There's no, Yeah, so exhaustion is a problem as well. So there's those are issues in if you compare to the other issues that we have in the civilian sector, but those are some of the issues or challenges that we face in the field.
Yeah, yes, and I know nurses in the Army play such a critical role in caring for the soldiers and also civilians involved in the conflict. Yes.
Yeah.
So thank
Yeah.
you.
So
Yeah.
it's our jobs. You can't turn around anybody. And when we go in deployments, who's you're going to be caring for is whether you deploy for soldiers or you deploy for the civilian canter. And some of us do go in the city and care for the civilians. I didn't get a chance to do that, but it's part of our deployment as well.
Oh, that is good to hear. Now we're going to go ahead and proceed on to our next panelist, Ms. Anne Modong. The question to you is, what are the services provided by nurses in the antenatal for pregnant women, and why are these services important?
Good morning, good afternoon, and good evening, everyone. I'm so glad to be in this discussion. So I'm just going to go direct to the question that was posed to me. Before we understand the services that we nurses and midwives provide during antenatal care, it's wise for our mothers out there to know what antenatal care is. So antenatal care, it's just a care that every pregnant mother receives from a skilled healthcare provider or professional. So antenatal care, normally the services that we provide pregnant women during antenatal care is a routine services that in every visit, every pregnant mother has to go through it. Before we used to use focus antenatal care, which was introduced by WHO, which South Sudan was also using. But now in 2016, WHO now came and said, we are not using the focus antenatal care anymore. We use a new method, and the new method now uses 8 contact methods. So that means in the period of 9-month pregnancy, we expect every pregnant woman to visit the healthcare facility for a minimum of 8 contacts or 8 times. You can do more than that, but you don't have to do less than that. So in these contacts are just like visits, but it's just a different English that was used. So in each contact, it has its own period. So in first contact, normally it's in the first trimester. So pregnancy is divided into three trimesters. We have the first trimester, the second trimester, and the third trimester. The word trimester it means 3. So the first 3 months, we call it first trimester, the second 3 months, second trimester, and the third 3 months, third trimester. So in the first trimester, we expect every pregnant woman to visit the health facility at least once. You can visit twice if you want, you can visit 3 times, but from day 1 up to 12 weeks of conception, we expect you to visit the health facility once. So in that visit, when you visit during that period, what we do for you as nurses, we take comprehensive history. We have to know your history. When was the last time you've seen your period? So that we establish which date in estimation that you're going to deliver in. And then we also know if there are any risks that comes with the pregnancy, because if you give us a history of having any disease that runs in the family or in yourself, health related, then you're likely to go through the same. So we ask you about that in that comprehensive history. And then when we take from you comprehensive history, we subject you into examination. So we normally concentrate on the abdomen. We have to know how the baby is. We have to listen to the baby if the baby is alive or not. So we listen through. And then also we provide you with counseling, health education on how to go about during the pregnancy period. And then now we also give you some drugs. It's a preventive drugs that can prevent you from some defects during the pregnancy, and then also it prevents you from risks that arises with pregnancy. So this is basically the basic that we do. Then we also expect you to come for second contact, and second contact happens in the second trimester, normally from 20 to 26 weeks. So we expect you to return back, and we also do the same. So in the first visit, normally we also do an ultrasound scan to be able to confirm the viability of the baby inside the uterus. So in the second trimester, in the second contact, we also do the same. We also subject you to health education. And also we give you those drugs that we always give. So among the drugs we give, we have folic acid, and then we have Fancida, we have Fefor, and then we have, basically those are some people can give you calcium sulfate, but some cannot. So that one is not among the basic ones, but the basic is normally that. And then we deworm you also. So also we expect you, after the second contact, you have to come back for the third contact. And third contact happens between 30 weeks and above. And we expect you to come back for fourth contact, fifth, up to eighth contact. So all contacts, we also subject you to the same. Normally, sometimes we don't take now comprehensive history in the rest, because we have already established from the beginning. So what we do, we continuously keep checking your abdomen, palpating basically, to be able to know, is the baby okay? How is the baby lying? Is the baby lying the head down, the head up? Is the baby lying as the buttocks are down? So that is where we normally be able to identify the different lies that baby lie with. So sometimes when you come to antenatal and then a midwife or a nurse tells you that your baby's the buttocks are down, you should not get worried. So these are the common positions that babies take when they're inside. So after that, we normally look at the importance of this antenatal care. Why do we do all this, and why do we subject you to those different drugs that we give you? We have three importance of antenatal care. So one of them we say is health promotion. The second is detection, and then the third is disease prevention. So health promotion, when
Hello, Miss Madame. Hello. I think she went offline. Because we're running low on time, we're going to go ahead and proceed. The next question is for you, Miss Agnes Lamoro. The question is, what is critical care nursing, and why is it important for nurses to be trained in critical care? Also, what are some of the common conditions that are managed in critical care units? And lastly, what aspect of nursing care that are focused on patient? Ms. Lamoro?
Hi, everyone.
Yes, you can proceed.
I'm glad to be here with you guys today. I've been following up the SSWI initiative for some time now, and I'm really glad that I get to participate today. So I can't even remember. Basically, critical care nursing is a branch of, it is a specialty within the nursing career that specializes in providing care to the critically ill patients that require immediate care of life-threatening conditions that would otherwise not be given if it was in the wards or the highly dependent unit. Usually manage cases or conditions that are usually acute. For example, when patients come in with life-threatening conditions like injury from maybe accidents or an exacerbation.
Miss Agnes.
A condition that maybe you had. For example, if a patient had diabetes probably and came in with an DKA. Some of us, I don't know if you know DKA. It is kind of an acute form of diabetes. So usually those are the cases support and
Excuse me, Miss Agnes.
cardiopulmonary.
We're having issue with your internet connection. It keeps going off and on, off and on. So we're only hearing bits and parts of your remarks. Okay.
I do not know what I'm going to do about that. So do I start all over again?
No, you can proceed.
Okay. Yeah, so basically it is important for nurses to be trained in the providing care to patients that are really require advanced medical treatment. So there are equipments that you need to manage that in other ways, if you are doing the general kind of nursing, if you do not go to school or if you're not and the medication that also you use in the critical care unit, it is going to be otherwise difficult to give the optimum care that you should give to the patient. So it's good to be trained in the for nurses optimum care. I mean, like the kind of like emergency care to your patients to bring them to optimum recovery.
Mm-hmm.
Yes.
Yeah.
So
Mm-hmm.
what was that?
Okay. Let's see if Aisha can help with the internet connection because it keeps going back off and on, off and on. Miss Agnes, let's see if Aisha can help with the internet connection because we're really having a hard time keeping up with the remarks. So if Aisha could assist with that, that'll be great. Yes, thank you.
All right.
Thank you. Yes. Yeah. So I'm going to go ahead and proceed to Ms. Nyandra since she has to proceed to do something else right now. So I'll go ahead and ask her the questions pertaining to her, and then we'll proceed on with the discussion. So the question to you, Ms. Nyandra, is, when dealing with adults suffering from chronic illness, what are the most common chronic conditions encountered in your experience? What screening is done by nurses at initial presentation and during follow-up for each condition? And why is this screening important?
That is a great question, and that is my expertise. I deal a lot with chronic illnesses. And to just give a definition of what a chronic illness is any illness that lasts for over a year and require ongoing medical treatment. Okay, so that is chronic condition, and also if it's stop you from performing your activity of daily living. So that would be categorized as chronic illness. And some of these chronic illnesses, some of the example would be like hypertension or high blood pressure, would be like diabetes, whether it's type 1 or type 2. Asthma would also be considered a chronic illness. And the last one would be like COPD. So just are some of the example. There's a lot of chronic illnesses out there, arthritis, kidney or liver diseases. But the main ones I've seen in my practice are the ones I mentioned: high blood pressure, asthma, COPD, and heart disease. And heart disease is usually comes after, and some of the two ones I named that cause heart disease would be like hypertension and diabetes. So those ones I've seen a lot in my practice. I was a cardiac nurse for a while. And some of the ways that we could manage those diseases would be primary prevention. And as nurses, we were taught in primary prevention, there's a primary prevention, there's secondary prevention, or tertiary prevention. And as a public health nurse, I'm a public health nurse now, that's where I got my degree in. As a public health nurse, we're mainly focused on the primary prevention. And primary prevention just basically means you are getting ahead of something before it happens, preventative. And the preventative measures for example, if we focus on, heart disease, we want to prevent heart disease, we would focus on managing our blood pressure. We're focusing on managing our, and we can manage our blood pressure by our diet, our exercise. So we make sure we exercise on a regular basis. We make sure that we eat healthy, and we also make sure that we are mentally well. We are healthy mentally. So those are the things we can do to prevent us becoming hypertensive or having high blood pressure, which could lead to heart disease. So that's primary preventative. So any disease that is out there could be prevented primarily, mainly. Most of the diseases can be prevented. So that would be the first thing we do. Okay. If that didn't happen, or you've done it, you did all you could to manage your blood pressure, somehow you still diagnosed with high blood pressure, then now we go to secondary preventative. And secondary preventative, you go see your doctors and he give you a log of, okay, so we're gonna keep track of your blood pressure, log it in a page, or you're gonna, I want you to exercise at least 3 times a day or 3 times a week to manage your blood pressure. And I want you to not eat this food, and this food. And he might put you on a medication, 1 or 2. So that's a secondary preventative. Okay. And then if that didn't happen, somehow it still got out of control. And now you are at a tertiary preventative, that you got yourself in the hospital. Now you're hospitalized, and we're working on getting you well, back on your feet with medications. So that now we are on that tertiary. You get discharged, you go home. Now you have a home health nurse that comes home and check on you. But the main focus should always be on the primary preventative. So we push a lot about it as nurses. We do a lot of teaching, but our teaching mainly focus on the primary and secondary preventative. We don't want to get to the tertiary. So that's
important.
We don't want to get to that third one. We want to focus on primary and secondary, and that's how a lot of these chronic diseases can be prevented.
Mm-hmm. Yeah, that is really good. I want to go ahead and proceed on, because I know you're leaving shortly, so I want to ask you questions here. The next one is task shifting possible for nurses who would want to practice surgery or medicine specialties in nursing? And also, in which specialties is training available? And what is the career path taken to make this possible?
Okay, that is a great question, and I'm going to try to answer it real quickly because I do need to go. And I have a book launch today, you guys. My book is coming out. I Am My Mother's Wildest Dream is coming out today at 10 o'clock Central Eastern Time. Go on Amazon and purchase it. So I'm going to try to do my best because I know my team is waiting for me out there on Zoom to start the Facebook Live. But to answer this question, this is why I love nursing as a profession. And I think you guys all feel the same way, that nursing is so vast that you could do anything you want. I when I went into nursing, I didn't know any of this. I didn't know that I can be a nurse practitioner. I could be an OBGYN nurse. I could be a psych nurse. I can go get my master and my PhD in nursing. None of this I didn't know. But now that I'm in nursing and I've been in for 10 years, I would do it all over again because of that flexibility. Okay. Nursing as a profession is so flexible that if you don't like one field, you didn't find you're passionate, you can go, or not. If you didn't like your specialty, you can always change specialties and go do another specialty. And the education hospitals that you are employed in could assist you in getting advanced nursing practice in whichever fields you are interested in. They can assist you, especially here talking in America. I don't know about other places, but a lot of hospitals will help you go get your master in, if you want to be a critical care nurse, you want to be an OR nurse, you can get your master in that. If you want to go teaching, you can get your master in nurse education. You want to be a leader, so you can go get your master in leadership, which was my first degree that I went in until I went to Juba. I wanted to talk about that. I went to school to get my master in leadership because I was in the Army and I didn't have really good manager at the time. So I wanted to be a better leader. So I enrolled myself in leadership courses. And then in 2012, I went to Juba, and I went to the Juba teaching hospitals. My heart broke for what I've seen. I've seen a lot of infection control that were just like violated everywhere. Patients were laying on the floor. There was not enough gauze to cover the wounds. Everything just looked, I saw infection everywhere. And as nurses, we are trained to see that. So I came back, and that's how I went to get my master in public health, because I wanted to go back to South Sudan and teach public health. Okay, that's why I have this master, and hopefully one day I'll go back to South Sudan. But nursing as a field, it is so much you can do, and there's so many things out there, or so many help scholarships. Your school, or not your school, your hospital can help you. As around, there's a lot of different ways you can go get your master in whichever fields you like. You know, we need OBGYN nurses in South Sudan. You know. Women's mortality during childbirth is very high, and I think we could help with that as nurses. And one of the things we could do is so the shift in nursing. I think in America or in Western world, we understand our professions is very needed. There would be no hospitals if there's no nurses. Doctors can go home and treat their patients at home, but because there are hospitals, nurses are the ones taking care of patients at the hospital 24/7 all the time. So we need to have that mind shift that our profession is evolving, especially in South Sudan. They need to release some of those responsibilities to nurses that doctors do, because we are capable of doing that. We just need to be trained. Anybody can be trained on something. So I didn't mean to rant, but this is my passion. This is what I love to do.
No problem. Yeah, we appreciate that. So no problem at all.
Yeah, thank you. I do have to go be on the book launch. So everybody on here, go get your book. And I'm going to leave the link here for you, Eunice. Okay. So, yeah. So.
Yeah, we thank you so much for coming. We wish you success in your book launch. And I look forward to it. Reading it.
Thank you. Thank you so much.
Thank you so much for joining us.
All right. Bye-bye.
Bye. Yes. So I'm going to go ahead and proceed to Ms. Joyce Youngu. We only have about an hour or so. So if we could proceed a little bit much more with the time management, that'll be wonderful. The question to you, Ms. Joyce, is what training is available for nursing and for further specialization? Where are these facilities available? I know you're located in Australia. Are there any in South Sudan, and what challenges do nurses face when trying to advance their careers in this profession?
Thank you again for the question. I answered the training previously in my first questions that where I am, there's a lot of facilities, and there's also a lot of support. In Australia, if you decided to go to university, there's always a government support financially. You can go study, finish your degree, and then pay back the university while you're working, while you're earning money. Most of the employment also encourage staff to do nursing, especially the diploma. If you work in facility and you're really doing good, and your manager can see that you have potential to become a nurse, they will encourage you to do nursing, and they will pay for it. The other thing that affect nurses that are already on the field, like RNs who wants to do masters in critical care or ED or mental health. The issues is because we nurses, we work so long time, like we work long hours. Working long hours will just reduce our ability of thinking, of going back to uni, especially when you have responsibility, such as family or family back home and family here. I know you are in US unis, you know, we always work for two families, one where you are and one back home, because you need to support your people back home during this time at the moment in South Sudan that people are going through hard time. That's one aspect that cannot allow nurses really to further their study more. The other thing is like the patient expectation, like the demand, the shortage of staff. We always, nurses, everywhere there's always shortage of staff. And that play a role as well, because all you will be thinking like, do I have to go to uni again, or do I just continue working to help my colleagues or or to just meet my requirement as a nurse, because after all, if you become a nurse, you start building that rapport with your patients, and leaving your patients or your ward to go and further your studies, you feel like it's not right. But that one come into individual decision whether they want to do that or not. The other thing, in places like South Sudan, obviously, I can understand. That there's no opportunity for people there, or for whoever want to do a nursing, like us, who are in Western world. There might be finance problem, there might be family, there might be stability of living. The area, the country is not going really as we expected, and that will limit your progressing in your nursing. So I think that is the challenges that nurses have if you want to further your career in both countries, wherever you are.
Yes. Yeah. Oh, thank you. Now I'm going to go ahead and proceed on to Miss Mary Kujang. The question to you is, when it comes to vaccination, what are the recommended vaccines in infancy, and what are the vaccine schedule? Also, what are the side effects associated with infants getting these vaccines?
We can't hear her. I think she needs to unmute herself.
Can you hear me? Yeah?
Yes.
Yes, vaccines are very important for prevention of a lot of diseases. And the recommended vaccine we have, like especially in South Sudan, because the vaccines are maybe scheduled according to the country. Like in South Sudan, we have 5. We have the BCG, which is the Bacillus granule. This is the bacteria. This BCG is to prevent the TB, and the second is given first at birth in the hospital, or sometimes they will refer you in the another health care. The second vaccine that we provide is DTP, Hep, and hepatitis B. This is the combined vaccine, 5 in 1. It's also given in three interval. First is given in according to the schedule in South Sudan. First is given in 6 weeks after birth, and then the second dose is given at 10 weeks, and then the third one is given of DPT Hep B is given at 14 weeks. This is the second one, and the third one we have the IPV, inactive polio. This is also given at the 14 weeks after birth, and then we have the OPV, which is a oral polio vaccine. It's given also in 3 interval. First is given from 10 weeks, 14 weeks, 6 weeks. It is start from the 6 weeks. Also 3, and then we have the measles. We have the measles, which is given at the 9 months. This is to prevent measles. This is given at the 9 months. But also we have some vaccines like Rota, and we have some combined vaccine like mumps and measles and rubella. We don't have them here. So maybe in other countries. And the challenges we are getting, and during giving this vaccine, is sometimes the mothers refuse because they do not understand. And also sometimes we have a shortage of the staff. When they come, they stay long in the line. Sometimes also we have shortage of the vaccine itself. Like you come today, you say you come tomorrow, and if they do not understand the importance of these vaccines because of the shortage of the staffs, we do not even have time to explain the importance of these vaccines so that the mothers, even if there is a long line, even if there is, they keep on coming to prevent their children. So the solution for this, we need to have enough staffs and to be motivated so that they come. Of course, when the staffs are not there, it's because they are not motivated. And also we need to provide the available of this vaccine, because this vaccine, it helps a lot of health issues from the childhood. Thank you.
I know we have such a high mortality rate when it comes to infants in South Sudan, so those vaccines are surely important. So thank you, Ms. Kujang. I'm going to go ahead and proceed on to Ms. Ann. The question to you is, tell us about emergency obstetric and neonatal care. What are the components of the EMOC, and what is the role of the nurse midwife in provision of the emergency obstetric and neonatal care? Can you unmute? Can you unmute yourself?
Thank you so much for the second question. I hope everyone is getting me well.
Yes.
So I'm going to talk about obstetric emergency and neonatal care. So in obstetric emergency, we have, these are emergencies that arises during pregnancy as well as during giving birth. So we have so many emergencies that arises during this period. I don't know whether I should really list, maybe I should list some of them to you so that you will be able to know. So we have miscarriage is an obstetric emergency that arises during pregnancy. We have ectopic pregnancies. We have preeclampsia, that is high blood pressure in pregnancy. Then we have premature rupture of membranes. Sometimes your membranes ruptures before the expected time. And then we have placenta rupture, that is placenta detaching itself from the uterine wall before the time that is expected. So those are the common emergencies that are there during pregnancy. So some of the signs that you will know that you have these conditions or these emergencies, you tend to have bleeding that are not stopping and it is heavy in nature. You have intense or severe abdominal pain and cramps that you don't seem to go out of it. You have dizziness, you have vomiting, severe vomiting, you have fever, you have lower back pain that comes intensely, and then you have blood vision, and then all of a sudden you see your body swelling out of nowhere. So these are some of the signs that will give you a clue that you have one of the conditions of obstetric emergencies. So obstetric emergency has components and it is divided into two. We have the basic obstetric emergency and neonatal care, and then we have the comprehensive. Basic has its own component and comprehensive has its own component. So when we look at the basic services or basic emergency obstetric and neonatal care, it takes place at the health centers, or we call it the PHCC, which is commonly known in South Sudan. So we have so many PHCC. We have in Kuro, we have in Melekia, we have in Munuki, and so many other places, Gurei. So we expect that the basic emergency obstetric care services has to be there in those PHCCs. So the components under basic is administration of perinatal antibiotics. So when a mother walks in those PHCCs, a pregnant mother, and she walks in with any infection related to the pregnancy, we expect that your facility or the PHCC should have available antibiotics that you as a nurse or a midwife, you should be able to administer to the mother based on the condition they present with.
Yes.
We also expect that you should be able to have anticonvulsions in that basic facility, so that a mother comes in and she's in a severe high blood pressure or in a state of eclampsia, you will be able to give them the anticonvulsion. And then also oxytocins, or we call them the uterotonic drugs. You should also be able to have them in that PHCC. You should be able to also have equipment that is needed for removal of retained products. That is, in case someone goes through abortion, maybe they had abortion and then they are running into the facility for help. As a midwife or as a nurse, you should be able to have the equipment you need to do MVA. Then you should be able to have equipments for resuscitation of the newborn. So there is also a set for resuscitation of the newborn. So in that facility, you should also, in the PHCC, sometimes mothers can come to you and then they are not really term, but then they're already in preterm labor, and then the time is just too short for you to be able to refer or transfer the mother to a higher facility. So you need to do the basic. You have to conduct the delivery. You have to save the baby before you transfer them to a next level. So as a midwife, this is our roles. Transporting of this mother after doing all the management you require is our roles as nurses to escort this mother to a higher facility. They're able to get a better services. So when we talk about the comprehensive components, it normally takes place at the hospitals. So we expect that in South Sudan, in each state, we are supposed to have hospitals. Hospitals have to have the comprehensive services for obstetric emergencies for both mothers and the babies. So in the comprehensive part, all the basic services are there, all the components are there, but we are including safe blood transfusion. We don't transfuse at the PHCC level. So if it is transfusion related, we transfer the mother to a higher facility. Then we also, oxygen administration is there for babies and performing cesarean sections in case of emergency.
Yes. Okay. Yes. Thank you. We're running short of time, so we're trying to really thank you for your feedback on that.
So you're getting me, huh?
I beg your pardon? Yes. So I'm going to go ahead and proceed on to Ms. Agnes. The question to you, Ms. Agnes, is what are some of the challenges faced in your profession in managing critical care patients, and what are the possible solutions, or what can be done better from the nursing perspective? Also, with the COVID-19 pandemic, critical care settings are overwhelmed and filled to capacity. What are the new challenges faced in nursing during this pandemic, and what are some of the solutions?
Hi, Brian. I hope you can hear me now. I'm back.
Oh, Ms. Agnes.
Okay, first, while managing, yes?
Yeah, it seemed like your computer was there for a minute.
Can you guys get me? Can you hear me?
Yeah, we can hear you, but it keeps going off and on periodically. So we hope that it's going to proceed seamlessly. But go ahead.
All right. So the question was the challenges faced in my profession in managing critical care patients and the possible solutions. So because of care nurses, but I'll just speak on two that I think of that are more more of concern in the medical field, and one of that be staffs of the critical care nurses. So as of now, I think I'll speak from where I am right now. I'm studying. I'm working in Kenya, and one of the challenges that each hospital has been facing is the issues of staffing. The nurse to patient ratios are really imbalanced. you'll find that most of the time the recommended setting for critical care nurses to the patient ratio should be 1-to-1. But you find that in most settings or hospitals, there are really no nurses. One nurse may manage even like 3 to 4 patients, which is really more of a workload to the nurse, and also really jeopardizing the safety for both our patients, because these are kind of the kind of for them one. So yes, the staffing issues and challenges, those are ones that have been there for the longest time. So the solution to that is that I realize that the hospitals and as that to employ them in the hospitals to manage our patients. The other challenge that I would talk about is also the lack of training for the critical care nurses. You may find that when you go through the nursing curriculum, we are taught in general be it the medical surgical nursing, the accident and emergency nursing, the maternity nursing. So you find that you've gone through all the nursing aspect of it. So and really not specifically trained.
Yes.
The lack of training there of nurses. Sorry.
Yes, there seems to be
Okay.
the connection problem. Yeah, but go ahead and finish your final point.
Okay, so another problem in nursing care. So the solution that I would possibly think will help in this is really the government training nurses in critical care an individual nurse, especially if you're just leaving school, to take yourself through the intense program of critical care nursing, and also knowing that it's really costly. So if maybe the hospital or the government can find a way of training nurses that you go to really step in the gap for that, I think it will be of good a good thing for the hospitals and for the patients as well. So yeah,
Thank you.
And
yes, thank you for the remarks. Indeed, our government needs to train more nurses. We have 2 questions here from
so
our
during
viewers.
this time of
Yes. So we have 2 questions from our viewers here. One of the questions is from Cecilia Karama, and she says, many patients die and are buried immediately in South Sudan. Her question is, why don't we have enough mortuaries within the country? Anyone want to go ahead and respond to that? Please make it.
So Cecilia wants.
Can you please
Cecilia wants to know. Yes.
Yes.
Cecilia wants to know about why we don't have enough mortuaries.
Yes, within the country.
Cecilia, it's a bit a tough question, but what I would tell you is that we are trying to I think the government is trying to establish more mortuaries with the help from organizations. So basically, I think the mortuaries we have currently within, especially Juba, is the one in Juba Teaching Hospital, which is now operational, and it has a bigger capacity compared to previously. And then we have the one in Juba Military Hospital. So I'm sure that as we continue to develop, as the country continues to look at improving health or the healthcare system, likely that we are going to have more mortuaries to be functional or operational soon.
Okay. Yes. Anybody else want to respond to the question? Okay. The next question is from Aurel Deng, and she says, nurses are the backbone of the healthcare system. I just wonder how well equipped is the unit in Juba. She's referring to the COVID-19 unit. And what is the impact of COVID-19 in the efficiency of nurses within the country?
Sorry, can you say the question again, Eunice? Just can you what does she wants to know, like, about
So she's asking about the efficiency of nurses during this pandemic within the country, South Sudan, and how well are they equipped to manage the pandemic?
I'll just try to I'll add something, some point that I because I tried to Google or research about the situation of nurses in Juba, and one of the things that I found out is that the nurses are not equipped with proper education and also proper equipment. Most of the nurses, even if they are equipped with the knowledge and the capacity to work as a nurse, they not most of them move to the countryside because that is where sometimes they work freely and they get paid for what they work for. That's just a few points that I found out. So I think the government in South Sudan need to tackle the healthcare system first before tackling nurses' problem, because I noticed that nurses everywhere, there's always a shortage of nurses everywhere, in the hospitals or in community or in other healthcare facility setting. But that doesn't mean that is the nurses' problem. That go back to the government to provide those facilities and provide those equipment and provide schools or university for nurses to get trained.
Mm-hmm. Mm-hmm.
I think that's what I can answer that question.
Mm-hmm. Yes.
Can I just add to what she said?
Go ahead.
Yes. I want everyone to know that South Sudan was the same as every country worldwide. We weren't prepared for the COVID, but as COVID set in, really, there was a great effort, especially from Salama. Salama is South Sudan Nurses and Midwife Association. They really did a great job. There was continuous capacity building for nurses at the state level and those ones who are based in Juba.
Mm-hmm.
So, and then there was also provision of PPEs for these nurses. So however much we did not have enough nurses, but those on ground were able to do their best based on the opportunity that was given to them. And then also we have to know that the entirely COVID-19 patients that were managed in Jongerang Infectious Disease Center was not entirely in the hands of the government. It was IMC running the facility. So it was the organization employing the nurses that were working in that health unit. So basically, yeah, we nurses in South Sudan did their best, and they're still doing their best to fight COVID-19 and to save our patients. Thank you.
Okay, thank you too. Now, Ms. Joyce, I'm going to move on and ask you the question, what aspects of public health are important for nurses, and how do nurses contribute to public health? Also, when it comes to the preventative aspects of public health, nurses are at the first point of contact. What preventive health services do nurses provide or participate in, and what challenges are experienced when providing these services?
Thank you for the question, Eunice. The question is too long. I try to put it in a short answer, but I couldn't. But public health nurses comprise the large professional part of the workplace in public health, and involved in their involvement is in educating the public and counseling individuals, because community nurse is most of the time working in the community, not in the hospital. So very much involvement in public health is by promoting exercises, or monitoring weight loss, or encouraging those who are alcoholic or smoking to quit, and also try to people with terminal illness like cancer who are receiving chemo in their own houses. So the nurses are very much in the community trying to minimize hospital transfer or hospital stays, so that the hospital beds are available for those who needed critical care. So in community, very much they try to ensure that the patient in the community are cared for and they're receiving the proper care that they needed, including prevention of infection control. Also, people with the catheter that need care in community, sometimes the catheter block and they need to be flushed. So those are things that is supposed to be done in the hospital, but because of the load of the patient and their care, so some people are discharged early to go to their home, so that the community nurse can be able to help. The challenges that nurses find in communities, especially here in this country, is the driving around, organizing your allocations, sometimes a wound care assessment or a swab that you need to do, and it takes long time to do it, and that reduce your ability to go and meet the other patient. Sometimes the distance between suburb and suburb, and that also put pressure on nurses, and that is some of the challenges. And also for nurses who got families, because if you work Monday to Friday, that also put pressure on you, because going to work at 8 and then try to tackle all of that and come home is also adding so much pressure, and give some nurses some challenges.
Yes. Oh, those are some good points indeed. I know with the driving and you can
I know.
time and managing all the patient load, it can be quite a hassle. So I'm going to go on to Miss Mary. When it comes to caring for children who have chronic conditions, what are the issues to take into account? Also, what challenges are experienced in nursing care? Any specifics to South Sudan in particular? And how does one circumvent these challenges? Oh, you're off. We cannot hear you.
Okay. Thank you for the question. The chronic illness for the pediatric, what is to be taken into the account is the considerations of the family, and consideration of the nurses and the equipment in the hospital, because this chronic illness is not going to leave them. Every time they are going to be hospitalized, every time the situation is going to be arise. And when this condition is arise, when they come to the hospital and there is no nutrition, as the situation is bad, the parents are going to go home to look for something. They are not going to stay there with the chronic illness of the child. So we need to take the needs of the families and also the nurses, because when, like Joyce have said about the community nurses here, because of the lack of motivation and the lack of experience, sometimes when these chronic conditions are discharged at home, we don't follow them. And we need also consider for the families, because when they go home, they can able to take care of this child with the chronic illness. Like, for example, if the child is having a heart disease, this child have diabetes, if this child have a lot of this chronic, where every time they come to the hospital, and they need also to work for the family income. So we need to teach them. We need to teach them that if this is a rice, you have to do like this, you have to do like this. So our challenge is we don't have staff, we don't have even the equipped hospital. Sometimes the doctor will say the patient is to be referred, and this person doesn't have any income to go to the father, like to refer to another hospital, to another country. So we really ask our government to equip our hospitals so that such kind of conditions, they can be managed within the country. Thank you.
Yes, thank you. Yes, indeed, our government needs to take the advice of the nurses and also ensure that nurses are part of the policy-making process. So thank you for that, Ms. Kujang. Ms. Madong, I'm going to go ahead and ask you a question. Please keep your response under 2 minutes. The question to you is, what emergencies are experienced during delivery? What is the nurse's role in this management? And what are the danger signs to watch out for during these emergencies?
So the emergencies that are experienced during giving birth, we have prolonged labor, and then we have high blood pressure that may set in as the mother is giving birth. It happens. And then we also have sometimes inversion of uterus. As you're trying to deliver the baby, the uterus comes out with the baby. This is an emergency. And then we also have rupture of uterus. Sometimes you're trying to deliver the mother and then all of a sudden a uterus ruptures. So these are few of the emergencies that may be experienced. And then we have the postpartum hemorrhage. As you deliver the mother starts bleeding, that is not stopping. So the danger signs to watch for is, normally we look at heavy bleeding. When a mother starts bleeding heavily and then the blood is not controlled. When a mother tells you she feels severe pain in the stomach. When the mother tells you that she feels she's not seeing well or blood vision. So these are some of the emergency signs we have to look for as nurses. So what we should do is to stay calm, and this is an emergency. You cannot manage it alone as a nurse or as a midwife. So you have to shout for help, call other teams, and then we use several maneuvers to rescue the life of the baby and the life of the mother. So also you have to coordinate that in case of something that you cannot be able to manage at your level. We also refer the mother to the next level as we have done the intermittent management. So this is just a brief that I would tell you. There would be much, but just to keep time, this is enough for now.
Yes, thank you for that. Indeed, teamwork is very important in the healthcare setting, particularly when it's in an emergency. Ms. Agnes, I'm going to go ahead and proceed to you with the next question, which is, what are the important infection control measures taken in the critical care setting while nursing a critical care patient? And why are these measures necessary? And what is the role of the nurse in this measure?
Some of the infection control measures that take place in the ICU. One is the proper hand washing. That is before handling the patient and after handling the patient, you should properly wash your hands to prevent, of course, the transfer of. One is color coding. That's knowing which ways to put where. That is usually well laid out in every hospital setting or in every ICU setting, so you know which ways to dispose where. And the other one is the COVID pandemic. The proper gowning, you should put on your gowns, the gowning, well, your doping and the donning technique, so such that you do not really to prove and the patient. The other one is proper sterilization of the equipment that you use on the patients, and also disinfection of equipment that are being used on the patient. So I think that is basically.
Yes, thank you. Indeed, we have to manage
to your patients, and when you come. Yes, and the role of the nurse, of course, just to make sure that all those measures are put into place so that you protect your patients as you take care of them, and also you protect yourself and you're for the patients, of course, in yeah.
Thank you. Yes, indeed, it's important for us to protect our patients, particularly in the hospital or any healthcare setting where infections are so prominent. Now I'm going to go ahead and proceed to you, Ms. Joyce. What is the role of the nurse at community level when it comes to healthcare provision or health promotion? And also, what is the most basic health facility that requires nursing services? And what services are provided at this level? Is this the case in South Sudan? If not, why? You're off. We cannot hear you.
Thanks for the question, Eunice. We all know that nurses, whether you work in the hospital or work in the community, we still got a standard and that we need to follow. So the role of nurses in community is very crucial in promoting health. As I said before, we need to ensure that the patient in community also look well after. The roles of community that involve the registered nurse to administer those medication like chemotherapy medication, I said that before, to attend to complex wound care also in community. And the other nurses like nurse practitioner that can also prescribe drugs. Nurse practitioner in the places like Western world, they are like assistant to doctors that is a more qualified nurse that can go and prescribe medication while the patient is looked after in their own home. The facility, the basic facility that we have here for community nurse. So we got mental health facilities where nurses are monitoring patients with mental health issues, depressions, anxiety. They go there daily to do depot, giving them injection so that their condition improve, and also there's no relapse in community without notice. The other facility is their own home. So many patients with terminal illness, cancer, if they decided to stay, they can decide to stay in their home, and they have got regular nurses visiting them. And we also got the clinic. In clinic, you work with GP. I'm not sure if that is what is happening in South Sudan. So in clinic, you'll be doing care plans for patients with diabetic, patient with the need physio review, patient who need regular doctor visit, doctor clinic visit. And then the other thing is also with the GP, you'll be responsible for doing immunization for babies or for grown up or adults. And also other facilities, the child and the family, that is like a center where a new mothers with new babies go there, and the baby is monitored from 0 to 2 years old. All the immunizations, all the monitoring, all the weights, all the motor skills, and all the development of the baby will be monitored in those facilities. In South Sudan, in case of South Sudan, I haven't been in South Sudan. I haven't practiced nursing in South Sudan. So I'll leave it to my beautiful sisters. They will help me if those facilities are available in South Sudan and if those services are offered there. Thank you.
Mm-hmm. Yes, I'm sure Ms. Kujang will be able to respond to those. That question itself. Now, Ms. Kujang, the question to you is, what is the nurse's role in emergency and critical care of children? What unique challenges are experienced for nursing in providing emergency and critical care services for children within the country? And what are the recommendations or possible solutions? I know in South Sudan, there's so many health complications and health challenges, but please address this important topic. You're off.
Thank you for this question. The role of nurses in emergency of the critical care services in children. Generally in South Sudan, we are not specialized. We do everything. Starting from triage, we do that. We stabilize the patient when the critical patient came. We stabilize the patient before the doctor comes. We also prepare the environment. We prepare the emergency tray in case of emergency. Like we take the vital signs, especially for the critical case. We do the vital sign per the situation. and we take action. Also, we cancel the families, because at this moment the families are so stressed. We also call the doctors. We call the doctors if the situation is very critical, and also we make a documentation. We also act as a coordinator between the family and the doctor and the nurses, and also we are like a translators, because they will ask, oh, what did the doctor say? It is the nurse role to explain that the doctor says like this and we need to do like this. And the challenges we are getting here is sometimes the nurses are just taught generally. We are not specialized. Sometimes the nurses are not trained. They don't have the competency, especially in emergency of the pediatrics, because pediatrics are very sensitive. Their things need to be calculated well. So those are the challenges. And also we don't have sometimes the pediatric are not taken into serious consideration, like the equipment for the pediatrics, like the BP for the pediatrics. Sometimes we don't have them. So those are the challenges, and the solution for this one is we need to train our nurses, because as nurses are the available staffs in the hospital. We need to train them to how to take initiative of taking care of when the emergency comes, so that we don't lose the person. Because when I'm not competent in the person camp, I have nothing to do. So we need really to equip the nurses with the knowledge, because they are the closest people to interact with the patient.
Yes. Thank you. Yes, and I know infants and pediatrics are so fragile, as you mentioned, and they require really a knowledgeable nurse to provide care. Ms. Anne Modong, I want to proceed to you. The question to you is, how do nurses or midwives ensure that the delivery process is not traumatic? Because I know giving birth is it's a challenging process itself, mentally and physically. And also, why are they important? And what are the aspects of post-delivery care provided by nurse midwives?
So I'm just going to go straight away. So how we can ensure that this is a solid responsibility of us, nurses and midwives. We have to make sure that we keep reassuring the mother. So when we talk about this traumatic delivery process, we talk about respectful maternity care. So here we have to ensure that mentally mother is stable. You have to keep reassuring these mothers. You have to respect the culture of mothers. If a mother tells you she does not want a male midwife to attend to them, we have to respect their decision. We have to not judge our patients based on their status, the social status. Patients have to receive, or mothers have to receive, the care as desired. We also have to ensure that there is enough privacy as we are conducting the delivery process. We have all the necessary equipments and the knowledge we need to save this mother's life. This is our responsibilities. And then physically, we have to ensure also that the environment is conducive enough for the mother. We also have to ensure the mother can take whatever position she wants to deliver in, as long as she is comfortable with. So that is her decision to take. We have to respect that. And what are the things we have to ensure that is in place is, one, we have to ensure that we have analgesics, which are painkillers. So a mother does not have to go through that severe pain while giving birth. We have to control the pain. However much, we shall not be able to control it entirely, but we have to reduce the intensity of the pain. If there is need for massaging the mother as she's going through the pain and she's comfortable with it, go for it and do it. So some of the post-delivery care we give this mother is we look at both the mother holistically and the baby holistically. We have to ensure that the mother fits well. We follow this mother through the 6 weeks post-delivery. We have to ensure their nutrition, their their hygiene, the hygiene of themselves, the baby, and the environment is a clean hygiene that will promote good health to the mother. We have to ensure that the mother does not go through any infection after delivery. So we have to give this mother some antibiotics. We have to ensure that we keep monitoring the state of the uterus. Is it contracting? Is it involuting or reducing as per the need? We have to also follow up this. We have to follow up with breastfeeding of the child and the mother, and then the cot care also is our responsibility in the post-delivery plan as we are giving this mother. And then make sure that you also discuss with the mother the possibility of family planning. What is her uptake based on that? And then also sex after giving birth, we have to make it clear that it is recommended. It is 6 weeks after giving birth. Before that, we don't encourage, but we cannot interfere with cultures. Cultures are different. So there is also dilemma in these. So basically, this is the
Well,
brief that
yes,
I will give.
yes,
Thank
yes.
you.
Thank you for that indeed. And I like the point that you raised in terms of if a woman states that, you know, she does not want a male nurse there, we need to respect that because we need to preserve patient rights. So that's a very good point that you raised. Now, Ms. Agnes, I'm going to go ahead and proceed to you. And the question to you is, what do nurses monitor? Why do nurses monitor critical care patients and really work within the critical care setting? And why are these important? Why are nurses important in terms of, because I know within the critical care setting, there's so many machines, there's the oximeter, there's the ventilator. It can become very intimidating for not only patients, but also for the family members. So what are the experiences needed by nurses in terms of monitoring these patients? And what are the possible solutions for the challenges that nurses face within the critical care setting?
Well, thank you, Eunice, for that. Unit itself is really intimidating, and for both the nurses sometimes, and also for the relatives. And it's really a place that is more where everybody needs really psychological support, be it the nurse, be it the patient. It's a place where we all need help somehow. So basically, nurses monitor a lot of parameters during the your work in the critical care unit, as every usually monitor a lot of parameters, just so that you know the deviation from normal, so that you'll find that in that cardiac monitor, you'll monitor the patient's heart rate, the blood pressure, the temperature, the respiratory. Thing goes wrong, because usually, of course, the normals, so that if you see that maybe the patient has high blood pressure, you may know what the problem is. You know how to intervene as from there, so that to avoid, of course, the conditions that will come from any deviation from normal. You know how to act, because being in the critical care unit, you need to be fast, and you need also to be a critical thinker, so that you know exactly what to do when your patient is at the point of crashing. You know what to do. They start going unconscious. So basically, all that you should be there with your patient. You should be able to know to monitor from when you came in to the point to which you leave out, how your patient has been progressing. From the patient. So you'll monitor the blood pressure of the patient, the heart rate, the respiratory rate, the pulse oximetry, and also the temperatures. From then on, you can detect now the problem that you can detect, be it an infection, cardiac arrest that is coming through, or be it a patient could be going into a shock, so that you will know what medication also to give. I think it's so important also for us to be on their toes, or be of the patient, because it's really usually of utmost importance to be there to act, I think, fast. Yeah.
Okay. Now, yes, thank you so much for your feedback. We have a question here from Dr. Akwat, and she says, how can nurses, you panelists, help to advocate for South Sudanese to take the COVID vaccine? She also says that people in Juba are hesitant to take the vaccine, and mostly foreigners are taking advantage being vaccinated in Juba Teaching Hospital. Do any of you panelists have a response to Dr. Akwat's remarks?
Thank you for the question. I would like to answer that question. So our responsibility to advocate for the uptake of this vaccine is to live or to lead by example. So if today I receive the COVID vaccine, I can easily convince or I can easily talk to someone else to receive. So as nurses, we have to go for it. And I'm sure most of the panelists might have gone for it. So I've already received my first dose. So it is safe, it is sufficient. And yes, there are some mild side effects that comes with them, but it is manageable. So yeah, I would say let everyone go for it. When you look at the COVID, when you look at the disadvantages and advantages, you have to look at what outweighs what. Are you willing to go through the infection? Are you willing to go bedridden? Are you willing to go to ICU? Or you are willing to reduce the intensity of the infection or prevent yourself from acquiring them? So this is a personal decision to make. Please outweigh the benefits and the risks that comes with it, then make your final decision. Thank you.
I'm just adding into that, one thing that make public hesitant to take medication or to take drugs is because they lack information or they lack education. So as nurses, we need to advocate that, educating the public about this vaccine, that is safe for them to take, reassuring that it's okay to take, and also I'm not sure how the system works, the community nurse work there in South Sudan, to be an advocate for this vaccine. Maybe mobilize a group or a center or a facility to invite women's or group of community in and give them the information so that they are aware that this vaccine is safe, and also the vaccine need to be available for the community or the public, without involving financial. Sometimes, if like in places like South Sudan, financial situation is critical, so it has to be advocated that this vaccine is free and you can come and have it at any time. Thank you.
Okay, I just want to add also something on what Joyce says and Anna. Yes, we can go ahead also to do like what we have been doing, using the vehicle and on the roadside in every corner, like the one of COVID-19, use the protections, use masks. We can also use that one. And also we can able to reassure the people that because there is other false information about this vaccine that you cannot produce, it can make clot, and a lot of things. And also because when people are traveling now, when you take one shot, you can still come for a test. So people say, why could I make a test using money and again going for the vaccine? So it's like not something, convenience. Thank you.
Yes. Now I'm going to go ahead and proceed and ask all you panelists the final question. So the question to you, Ms. Joyce, is, do you have any concluding remarks or recommendations for the way forward as it relates to nursing, community care, and public health?
Sorry, can you ask the question again?
Yes. Do you have any concluding remarks and recommendations for the way forward as it relates to community care and public health?
My recommendation for all us nurses is that, or for the public, that your health is your first priority. One of my questions here is about mental health, and mental health is my area that I'm going to further my studies on, because in community, I think the most important things is we need to tackle the mental health issues, especially in us Africans, Africans people or people from Africa. We most of the time think that mental health is not for us. We mistaken the information. So for me as a nurse, I need to advocate in that area of mental health. When you get your mental health healthy and is perfectly well, your physical health will be much better, and you'll be able to reason, and you'll be able to also to take your health seriously. But if your mental health is damaged, you are not thinking correctly, your mindset is not in a correct level of thinking, like what with the vaccine now, people are confused and hesitant, and that means that there's issues with that. My recommendation also for us is that we need to maintain our standard as nurses. When we started the panel, I heard they say people are being smacked in South Sudan when giving birth. I think that's a poorly practice for us nurses. And if I'm in such countries where I know that the standard of nursing is lowered into that level, I'll be saying no. So as a nurse, you need to be humble. You need to respect your patients. You need to advocate for them, and you need to encourage them to look after their health. Thank you.
Yes, thank you indeed. Respecting patients is so important. Now, Miss Mary, also to you, what are your recommendations for pediatric nursing within South Sudan? You're off.
Sorry. Yeah, thank you. My recommendation here is the health system in South Sudan is still weak. I will really emphasize or recommend mostly for the training for the nurses. Nurses have to be trained, and nurses have to not depend that the government will come and train me. Let us take that responsibility ourselves. Like I can check through online. I can ask a reference like this panel is really very important. We introduce ourselves to many important great nurses. Also, we need to take health education very important, especially for mothers, so that those issues will not come up. So when we educate those mothers, they can able to take care of their children, and the situation will not come back to chronic. The situation will not come back to the chronic level or the critical situation. They can manage them at home. They can also know the danger signs when to come to the hospital and what to do when the temperature, for example, rises. So I'm mostly emphasized on the health educations of the mothers and also the training or the competency for the nurses.
Yes, thank you, Miss Mary. And now on to Miss Anna. What are your recommendations in order to improve delivery of care in the midwifery and obstetrics field?
So my recommendation will be there is a need for strong professional body, and then there is also need for regulation of the profession or the practice of the midwives and the nurses. Then there is also need for increased resource allocation, especially towards the nursing profession, which is not mostly existing in our country. Then there is also need for regulation of regulations of the profession, and then also there's need to strengthen the education system for both nursing and midwives. And then to the mothers, my recommendation to those who are planning to conceive or become pregnant, my recommendation to you is always plan your pregnancy, have your delivery plan before conceiving, and continuously monitor your pregnancy with the help of a health provider or professional health provider. And to those who are pregnant also, please attend your antenatal, please attend your antenatal, and please attend your antenatal. Thank you very much.
Thank you as well. Now, Ms. Agnes, in relation to the critical care profession in nursing, what are your concluding remarks and recommendations?
I I think I'd recommend for more training of critical care nurses to be able to manage the shortages that are currently there. So more training for critical care nurses, and also the other one is for the nurses participating in continuous education, because healthcare is dynamic. New information is coming up every day, and
We can't hear you that well. You're muffled.
Okay.
Go ahead.
Critical care nurses to participate in. Can you hear me?
No, your sound is very muffled.
So there's a sound coming from somewhere. Somebody's mic is on, so I cannot really get.
Okay, can we turn off our, can we be on mute so we can hear her better?
Hello. Okay. Yes, I think that's better. So my recommendation would be for more training of critical care nurses to currently cover the shortage, because as of now, there are few critical care nurses that are trained to work in the critical care units. So more trainings so that at least we can be able to offer effective critical care to our patients. Care system, or for any nurse, is to continue studying. Like I think you can't really, as a nurse, you can't really reach to a point where you say you're finished studying and you already got the knowledge that you want, because healthcare is dynamic, and information is shown. The one that in school may not be able to help you maybe some few years to come from now on the better way to manage our patients. So continuous learning, yes, for all of us. Yeah.
Yes, thank you. The South Sudanese Women Intellectuals Forum would like to thank the panelists for contributing their wealth of knowledge and expertise to this important topic. We would also like to thank once more our South Sudanese ladies and community members who have taken their time to watch and contribute to this discussion. Last but not least, thank you also once more to UN Women for their participation and partnership. Dear viewers, please join us next time on the South Sudan Women Intellectuals Forum as we continue to learn, empower each other, and improve our community together. Thank you.